You're good.
All right, Tim, thanks. So, ladies, we're going to move on to our conversation about medication. Thank you for taking some time to introduce yourselves to each other and to me. It's good to get to know you. As I said, I really want to keep this as global as I can, and at the same time give you a little bit of meat about some of these medications that you're encountering. The first thing I want to tell you about is every drug has three names. Every drug has three names. It has a chemical name. The chemical name describes the atomic and the molecular structure of the drug, and it's usually too complex for anybody to, in general way, to use. It has a generic name, and those are commonly an official body assigns a generic name to a drug. The generic name of drugs are particular, and they generally have the same ending, like compazine or benzopines or things like that. The brand name is the third name of a drug, and usually that name is selected by whoever manufactures the drug. And it's either shorter and easier to remember than the generic name or the chemical name. That's why they use it. And I'll give you an example. Amitriptyline is also known as Elavil. Which name do you think you'd remember more easily? Elavil. Right? Lasix is the name for furosemide. Which do you remember more easily? Lasix. So that's why they do that. Medication categories. The categories I'm going to talk most about are what I refer to as the anti-drugs. ANTI, the anti-drugs. These are antibiotic, antiviral, antifungal, antiparasitic, antipsychotic, antidepressant, anti-anxiety, anti-dementia, antihypertensives, anticoagulants, antiemetics, antiflatulents, and antacids. There are other medicines in different categories, which I will briefly speak about at the end, but these are the ones I'm going to spend most of the time on, because these are the ones you're going to commonly encounter. All right, let's start with the word anti, which means what? Anybody know what that word means?
Depressing?
No, anti. Just the little prefix, anti, A-N-T-I. Do you know what that means?
Against.
Against, exactly. It's a Greek word, and it means against. So keep that in your mind as we think about these medications. Okay? Antibiotics. There are different types of antibiotics. There's a broad-spectrum antibiotic, and there's a short-acting antibiotic, or narrow-spectrum antibiotic. The broad-spectrum antibiotics are used to treat all kinds of illnesses. The narrower ones are for very specific types of bacteria. Antibiotic, the word itself means against life. Bacteria is a life form.
Right.
Okay? And many illnesses are caused by bacteria, and that's important to keep in mind, because you can avoid these bacteria by using certain techniques. That isn't our point of discussion today, but it has a lot to do with why we stress things like hand washing so avidly. Okay? Antibiotics also need, well, I should put it this way, there are antibiotics that attack aerobic bacteria, those bacteria that need oxygen. Then there are other types of antibiotics that attack anaerobic bacteria, which don't need oxygen to live. Can you imagine a little creature, microscopic, that can survive in the world without having any oxygen? How long do you think you'd last if you didn't have any oxygen? Not very long. It's amazing what we see around us in our work. Antibiotics target microorganisms such as bacteria, fungus, and parasites. These are found in syphilis, tuberculosis, salmonella, staphylococcus aureus, pneumonias, and in meningitis. They are not effective against viruses. An antibiotic is not used to treat a virus. So when you go to your doctor and you've got a cold and you say, will you give me an antibiotic? They're going to say, no, we won't. Because it's not caused by a bacteria. Some pneumonias are caused by bacteria, and those will be treated with an antibiotic. But just because you have upper respiratory symptoms doesn't mean you have pneumonia. Doesn't mean it was caused by a bacteria. Right? So it's really important to hear that the suggestion of using an antibiotic to treat a common cold is not the right thing to do. Consequently, if an infection is important, it's important for you to know what caused it. It's important. That's why doctors do diagnostic testing to find out whether this is caused by a bacteria or a virus. They can tell by looking under a microscope what the case may be. Most of the upper respiratory infections, such as common cold and sore throats, are generally caused by viruses, as I said. And again, antibiotics do not work against these viruses. Before bacteria can multiply and cause symptoms, the body's immune system usually can destroy them. Usually. Our white blood cells attack harmful bacteria daily without our even being conscious of it. When symptoms do occur, our immune system can usually cope and fight off the infection by itself without any help. However, there are times when the system is overwhelmed or it's weak, and the addition of an antibiotic is helpful. Antibiotics all work in one of two ways. They destroy or they slow down the growth of bacteria by killing them outright or preventing reproduction. The little buggers can't reproduce themselves, is really what it comes down to. They do this until the immune system kicks in again and can take over those same tasks without the antibiotic being present. Another reason why antibiotics are only prescribed for short courses. Okay? Not something you want to be on permanently. There are some conditions that people are put on antibiotics for long periods of time. But those are rare conditions, and typically those people end up with a lot of other complications relating to the side effects of being on antibiotics for a long period of time. One common one is fungal infections result from the presence of antibiotics in your system. Because they kill off the normal bacteria that might help you, like in your gut or in your mouth. Thrush is a form of fungus that develops often during antibiotic treatment. And it's because the good bacteria you have in that case, in your mouth, end up dying because the antibiotics kill them or interfere with their ability to reproduce. That was just a side example. Antibiotics are sometimes given preventatively, like I said, to reinforce the ability of the immune system to control unhealthy bacteria. They are commonly used before bowel and orthopedic surgeries, as an example. They do that to get your body level in a place where you're best able to fight off infection. And anybody who's been around the hospital knows most of the hospitals in our country have outrageous records for secomial infections. And that's just the way it is. Some bacteria are harmless, and they benefit us, like the ones that are found in our oral cavities or in our bowels. These we do not want to disturb unnecessarily by the use of an antibiotic, if we can avoid it. All right, how do we use antibiotics? Antibiotics are usually taken by mouth. However, they can also be administered by injection or applied directly to the affected part of a body. They can also be given by IV. All right. Most antibiotics start out having an effect on an infection within a few hours. It is important to remember to complete the whole course of an antibiotic to prevent infection from coming back. If you do not complete the course, there is a higher chance the bacteria may become resistant to future treatment. Because the ones that survive when you did not complete the course have had some exposure to the antibiotic, and they may consequently have built up a resistance to it. Even if you are feeling better halfway through the course of an antibiotic, don't stop taking it. Take the full course so that you do not set up a situation of resistance. Some of the antibiotics should not be consumed with certain foods and certain drinks. Others should not be taken with food in your stomach. These would normally be taken about an hour before a meal or 2 hours after a meal. It's crucial that you follow the instructions correctly if you want the medication to be effective. If you are taking metronidazole, you must not consume alcohol with it. It's one of the few antibiotics that you're not supposed to consume alcohol for. And you'll be told that at the time that you get the prescription, and you will also be told which ones you should take with food and which ones you should not take with food at the time you get the prescription. This applies to the people you're taking care of as well. They may not remember as well as you. So sometimes it's important, if you're in that situation and the person you're caring for is taking an antibiotic, to find out what kind it is. And if you have to, go to the bottle and look at the bottle. It'll tell you right on there what to do or what not to do. Okay? Dairy products should not be consumed if you are taking tetracyclines, as they might affect the absorption of the medication. Antibiotics may clash with other medicine. If you are taking an antibiotic, do not take other medicines or herbal remedy without telling your doctor first. Because there are certain herbal remedies which interfere with the function of antibiotics. Over-the-counter medicines might also clash with some antibiotics. And again, the best thing to do is, if you have any question or doubt, is ask the pharmacist before you walk out of the store or the pharmacy with whatever prescriptions you may have. Or if you're in a caregiving situation with your own family or with a client and you have any questions, don't ever hesitate to call a pharmacist. You know, it's okay for you to pick up the phone and make a call. I mean, just call a local pharmacy wherever you are and just say, you know, I'm working with this person and they've taken this medicine and I'm not sure about it. Can you help me to know something, what I need to know? The last thing about using antibiotics that I want to share is that penicillins, cephalosporins, and some other antibiotics may undermine the effectiveness of oral contraceptives. If the antibiotic has caused diarrhea, vomiting, the absorption of contraceptives may be disrupted. If you are taking any of these antibiotics, you should consider taking additional contraceptive precautions while you're on the antibiotic. Okay? Now, can you overuse an antibiotic? What do you think?
Yes.
You can, right? That's right. I said that earlier. There are concerns worldwide that antibiotics are being overused. Unfortunately, we're finding them in our food. We're finding, because the animals, many of the animals that we are eating, or many of the plants that we are consuming, somehow get affected by chemicals that are antibiotic chemicals. So antibiotic overuse is one of the factors that contributes to a growing number of bacteria that are becoming resistant. And the examples, best examples I can give you of that are MRSA, methyl-resistant Staphylococcus aureus, and VRB, which is vancomycin-resistant bacteria. Those two are, right now, there's a couple of others, but I didn't want to bother naming them because they're not as common as these two. These two here are very much a problem worldwide.
The first one was one, the first three.
Yeah. MRSA is one. That's
MRSA.
methyl-resistant Staphylococcus aureus. Which
Oh, okay.
Staphylococcus aureus
So
is
those were
a
the-
bacteria that is commonly found on your skin. And over the years of treating skin disorders and other disorders with bacteria, with antibiotics, some of these natural bacteria have become resistant to this. So when you actually get an infection of this kind caused by this particular bacteria, there's a limitation on which antibiotics they can give you that are going to be effective against this particular bacteria. All right. What are the side effects of antibiotics? Well, the most common side effects are these. Diarrhea. Researchers from Stanford University School of Medicine found that a rise in sugars in the gut following antibiotic treatment allows harmful bacteria to get a foothold and causes infection. Harmful bacteria thrive on sugar. And then you have feeling and being sick. when you're taking the antibiotic. And lastly, fungal infections in the mouth, in digestive tract, and the vagina are commonly caused by antibiotics. What are the rare side effects? Formation of kidney stones, abnormal blood clotting, sensitivity to the sun. That one is particularly sensitive with tetracyclines. Blood disorders, deafness can sometimes occur when taking erythromycin. Some patients, especially older ones, may experience inflamed bowels, a form of colitis, which can lead to severe diarrhea. Clindamycin, an antibiotic used for the most serious infections, commonly has this side effect. It irritates the bowel so severely that the person ends up with severe diarrhea. However, although much less common, penicillins, cephalosporins, and erythromycins also may cause severe diarrhea. For the sake of general knowledge, antiviral, antifungal, and antiparasitic medication are similar to antibiotics. It's wise to think of them and to use them in a manner that you would, in the same manner or a like manner that you would antibiotics. A pharmacist or a prescribing agent should be able to provide any specific differences between these particular medicines and the ones that are non-antibiotic. So I'm not going to go through those particular categories because what I've told you about antibiotics will pretty much apply to antivirals or antiparasitic medications, okay? Or antifungal medications, I should say. Now, that sort of concludes that segment. Let's go on to antipsychotics. You're going to encounter those particularly in elderly patients who are demented. Antipsychotics are a group of medicines that are mainly used to treat schizophrenia or mania, where you feel high or elated, caused by bipolar disorder. That's why it's related to schizophrenia. They can also be used to treat severe depression and severe anxiety disorders. Antipsychotics are sometimes also called major tranquilizers. Older antipsychotics have been used since the 1950s and are still prescribed today. Newer antipsychotics were developed in the 1970s or later, and it was originally thought that these new antipsychotics would have fewer side effects than the older ones did. However, we know that there are also quite a few side effects from the new ones, just like there is from the older ones. The antipsychotic agents can be divided by chemical types. The first ones are phenothiazines. They are the oldest group of antipsychotics, and it includes these chemicals: chlorpromazine, which is thorazine; mesoridazine, which is sarentil; prochlorperazine, which is compazine; and thoridazine, which is mellaril. You can see why they don't use the chemical names too often. These drugs are essentially similar in action and adverse effects. They may also be used as antiemetics, although prochlorperazine, compazine, is the drug that is most often used for antiemetic action. Compazine is the most common one used. They have it in the form of suppositories, they have it in the form of tablets, and they can give it by injection as well.
Can you refresh my memory, what's an antiemetic? Oh, to keep
It's
you from
keep you
throwing
from
up?
vomiting.
Keep you from vomiting.
Keeps
Does
you
it
from
make
vomiting. No, it keeps you from vomiting. It's an antiemetic.
Mm-hmm.
All right, the next category is phenylbutylpiperidines. This includes haloperidol and ORAP, O-R-A-P. Haloperidol is probably the most common one that you would be familiar with. They find primary use in the control of Tourette syndrome. Haloperidol has been extremely useful in controlling aggressive behavior, and that's often seen being used in the elder population. But it's usually a later stage drug of choice. They don't like to use it too soon because it really is impairing to an older person. The next category is dibenzapine. D-E-B-E-N-Z-A-P-I-N-E, dibenzapine derivatives. This includes clozapine, which is clozaril, loxapine, which is loxetane, olanzapine, which is Zyprexa, and quetiapine, which is Seroquel. These have been effective in controlling psychotic symptoms that have not been responsive to the other classes of drugs. Then we have benzoxidil as a group, and it's composed of risperidone, or Risperdal, and Geodon, which is ziprasidone. Risperidone is the most common one, and it has been found useful for controlling bipolar mood disorder, while ziprasidone is used primarily as second-line treatment for schizophrenia. So you can see, just by what I'm expressing here, these are pretty potent medications used for some very specific purposes. But you will see them used in elders who have dementia. The last category is the last thing I want to say is antipsychotics also includes lithium carbonate, which is also known as lithonate. It is used to control bipolar mood disorder, and Navaine is another one of the drugs that is in a category all by itself, and this is used for psychosis. Antipsychotics are thought to work by altering the effect of certain chemicals in the brain. These chemicals are called dopamine, serotonin, noradrenaline, and acetylcholine. These chemicals have the effect of changing your behavior, changing your mood, and changing your emotions. Just as a little aside, anybody who is a runner effectively produces a large dose of serotonin and dopamine when they run, which is the same feeling you get when you take a narcotic. And as a result, that's why running is often seen sometimes as an addiction. Because the person feels so good after they had gone out running or done exercise, even people who just do regular exercise, heavy workout, they produce these chemicals in the brain, and that causes them to feel this sense of elation, this sense of comfort, this sense of strength.
Swimming does that.
Swimming does the same thing. Anytime you exert excessively, you produce these chemicals, and they satisfy certain aspects of your happiness, certain aspects of your feelings of well-being. Okay, so note that these chemicals, these antipsychotics, do affect these different parts of our brain chemistry. Dopamine is the main chemical that these medicines have an effect upon. That's the one, most antipsychotics affect dopamine. Okay. Altering the effects of these chemicals in the brain can suppress or prevent you from experiencing hallucinations, such as hearing voices or seeing things crawling on the wall. It can keep you from having delusions. And these are ideas that are not based in reality. I think that I'm the King of England. Or I'm the emperor who walks down the street with no clothes on. Because I think that I'm fully dressed, even though I'm not. That's a delusion. Okay. Thought disorders are also affected by these antipsychotics. And extreme mood swings that are associated with bipolar disorder, the manic to the depression, those swings back and forth are neutralized by these chemicals. Antipsychotics are available as tablets, capsules, liquids, injections. That's the more long-acting ones, or the injectables. And they also come in various brand names, different makers. So what are the common side effects? They include these: dry mouth, blurred vision, flushing, constipation. These may ease off when you get used to the medicine. Drowsiness or sedation, which is also common but may be an indication that the dose is on the too high side. A reduced dose may be an option to help you stabilize. Weight gain in many people develops as they stay on these antipsychotics over long periods of time. Weight gain may increase the risk of developing diabetes and heart problems in the longer term. This appears to be a particular problem with atypical antipsychotics, notably clozapine and olanzapine. Those two in particular bring this weight gain thing about. Your weight and blood pressure are usually measured before you start treatment and every few weeks after for the first few months. Thereafter, they usually measure every year, once a year. They do a level to see where you stand. Note, people who take clozapine need weekly blood tests for the first 6 months and biweekly or monthly tests after that. This is because it can have a serious effect on how many blood cells you make. That's one of the side effects of this particular drug. It does have a destructive effect upon your blood cells. Movement disorders are also part of the side effects of antipsychotics. These include Parkinsonism, which the symptoms literally resemble the Parkinsonian disease that a person with Parkinsonian disease would have. Tremors, muscle stiffness, those are some examples of what I mean by Parkinson-type symptoms. Another movement disorder is akathisia. This is like a restless leg syndrome. Your leg is always moving. You can't keep it from moving. And some people have that as a separate syndrome, but these drugs bring that type of symptom about. Okay. Another one is dystonia. This means abnormal movements of your face and body. Okay. And that's not necessarily specific to any part of your body. And another one is tardive dyskinesia. And there is a special assessment that has been developed to examine tardive dyskinesia and its presence in someone taking antipsychotics. It's used a lot by nurses to determine if someone's level is excessive or not. Because if these symptoms worsen, tardive dyskinesia worsens, then you have to get the adjustment made to the blood level. Tardive dyskinesia is a disorder that can occur if you take antipsychotics for several years. It causes rhythmical, involuntary movements. These are usually lip smacking and tongue rotating movements, although it can affect both your arms and your legs as well. About 1 in 5 people treated with typical antipsychotics eventually develop tardive dyskinesia. And when we assess, one of the things you do is you have the person open their mouth and you watch their tongue to see what it's doing. Literally, I mean, and they have no control over it. They don't even know it's happening, but their tongue will be moving all over the inside of their mouth.
Wow.
Yeah. The last symptom is atypical antipsychotic medicines are thought to be less likely to cause movement disorder side effects than the typical antipsychotic medicines. This reduced incidence of movement disorder is the main reason why an atypical antipsychotic is often used first. Atypicals do, however, have their own risks. In particular, the risk of weight gain. Again, it seems to be a predominant one. If movement disorder side effects occur, then other medications may be used to try to counteract them. Okay, enough said about antipsychotics. Let's go on to antidepressants. Antidepressants are a class of drugs that reduce the symptoms of depression by correcting a chemical imbalance of the neurotransmitters in the brain. The chemical imbalances may be responsible for changes in mood and behavior. Neurotransmitter, and what I'll say about that is if any of you, and I'm sure some of you, all of you probably have known someone in your life somewhere along the way that has shown signs of depression. People are at different stages of depression. People that you encounter maybe way into it and totally immobilized by it. Some other people may be at the very beginning stages. You're going to see all the range because every person's brain is different and every person's chemical makeup, even though it has the fundamentals of humanity, are individual to each of us. All right, so that's why people who are treated with these medications have to be tweaked very carefully because we're all individuals and we want to give the person the individual care. Neurotransmitters are absolutely vital. They are the communication link between our nerves and our brain. Neurotransmitters reside within vessels found in nerve cells, which are released by one nerve and then taken up by the other. And in between the nerves is a little gap called a synapse. And that information has to pass over that little space. So these chemicals actually are how this is transmitted across this little space. Neurotransmitters not taken up by other nerves are taken up by the same nerves that release them. So those same nerves get overdosed with this chemical. The process is called reuptake. The prevalent neurotransmitter in the brain specific to depression is serotonin, dopamine, or norepinephrine, which is also called noradrenaline. Those are the three most common transmitters that bring about depressive change. And it's because they get out of balance. And most of the antidepressants act in some way to change the level of these three chemicals in the brain.
Could you repeat those three chemicals?
I can. It's serotonin,
Yeah.
dopamine, and the last one was norepinephrine. Epinephrine is a chemical in your body that excites you. Adrenaline is something that stimulates you to be really active.
Is that adrenaline actually? Norepinephrine is also adrenaline?
It's noradrenaline. You have epinephrine and you have adrenaline and you have norepinephrine and noradrenaline in your body. They're two different chemicals, slightly changed chemically or physically. Their molecular structure is slightly different, and they do have different effects. But why I bring it up is because people who get excited about something or people who get fearful of something, their adrenaline is stimulated. And that's what gives you the decision to run away or stay and fight. You get all pumped up. You know how people say, I'm all pumped up? Well, that's what it means. Their adrenaline level has been escalated. And
That's why people like horror films.
Yeah. They sit there and their heart is beating really fast, or if somebody frightens you, think about that. If somebody walks up behind you and scares you, your heart starts to race real fast. That's because adrenaline suddenly got injected into your system. So, moving to this, in general, antidepressants work by inhibiting the reuptake of these specific neurotransmitters, hence increasing their level around the nerves within the brain. And the selective serotonin reuptake inhibitors, that's the SSRIs, that's a category of antidepressants, they affect the serotonin level of the brain. The only one they affect is that one, because they're designed to do that. Antidepressants are used to treat several conditions. I'm going to tell you what they are. Some of these conditions include, but are not limited to, depression, generalized anxiety, agitation, obsessive compulsive disorder, manic depressive disorder, childhood enuresis, which is bedwetting, major depressive disorders. Like I said, some people are over here, some people are way over here. Diabetic peripheral neuropathy pain. Diabetics suffer a lot of neurologic pain. For some reason, these antidepressants have a positive effect upon reducing the level of that pain because they affect the nerves. And serotonin, as I told you before, is a drug that brings pleasure. And if that's in balance, you're going to feel more comfortable. They also treat neuropathic pain, social anxiety disorders, and post-traumatic stress disorders with antidepressants. There are off-the-label uses for antidepressants also, but and these are a few of the ones that I'll give you. Fibromyalgia. Anybody know anyone with fibromyalgia? It isn't a very fun thing. Chronic urticaria, which is hives. Some people have chronic hives. Everything, they go around the world and everything, they're allergic to everything. Hot flashes are treated sometimes with antidepressants. and hyperhidrosis, which is a medical condition in which people sweat excessively and unpredictably. They may sweat even when the temperature is cold and when they are at rest. They haven't done anything. They're just sitting still. Another problem that's treated with antidepressants sometimes is severe pruritus, which is itching. Premenstrual symptoms are sometimes treated. Bulimia nervosa is also treated. Tourette syndrome. And lastly, binge eating. Those are all disorders that are treated with antidepressants, or may be treated with antidepressants. Every antidepressant that is used for depression is effective. All antidepressants that are used for depression are effective. There's no evidence that one antidepressant is more effective than another.